Okay, the live is getting set up. All right. Hello, everyone. Thank you for joining us today in our webinar. We will begin this webinar with a short introduction on Shifa Community Clinic and on our guest speaker.
Hello and welcome to Shifa Community Clinic's outreach webinar. Today's topic is analyzing dental health trends and if they are harmful or helpful. For those of you who do not know, Shifa Community Clinic is one of UC Davis' 9 student-run clinics that provides health insurance to the underserved and uninsured population of Sacramento. Our clinic has a plethora of specialty clinics, including, but not limited to, dental clinic, women's health clinic, legal clinic. We see patients via telehealth appointments and in-person appointments every Saturday of the month. You can schedule an appointment with us by calling our clinic at 916-441-6008 between Monday and Thursday. Please leave your name, contact information, and reason for the appointment. Our clinic is located at 419 V Street in Sacramento. You can access this information on our website at www.shifaclinic.org. Our guest speaker joining us today is Dr. Moed Khan, a valued alumnus of Dugoni School of Dentistry. He is a dedicated dentist who volunteers his time to serving the patients of Shifa Community Clinic.
Dr. Khan, are you able to share your slides?
Yeah, let me just get these going here. Sorry about that. Do you guys have me on there? Good?
Yes, we're good.
Perfect. Hello, everyone. I am Dr. Khan, and I just want to say thank you guys for joining us this morning. Thank you to the Shifa crew for having me on. I think it's an important topic to talk about tonight. I think it'll be, hopefully we can pick up a few new things from it, and hopefully it can be helpful for you guys. So today I'm presenting on the dental health trends, either harmful or helpful. And we'll dive into a few different things today, and hopefully we can pick up a few things. Let me see if I can get this going. There you go. That's me on the left. I am a general dentist here in Sacramento, California. Like I mentioned, I did graduate from the University of the Pacific Arthur Dugoni School of Dentistry a few years ago. Currently, I'm the owner and the dentist at Lush Dental Studio. That's my private office. And then I am the dental lead with Shifa's Community Dental Clinic that we established about over a year ago now. So that's kind of where you'll find me during the week. That's my email address down there and my office phone number in case anyone needs to get in touch. That's my private office where I'm at kind of Monday through Saturday. And then that on the left is kind of where I'm at. Like I said, Monday through Saturday, that's my office. And then on Sundays, that's usually where we're at, trying to volunteer and help out through SHFA. So again, I'm fortunate to be in the position where I'm able to see patients at my own clinic at a private office, like you see on the left, with a lot more technology, a lot fancier stuff, a lot more comfort. And then I'm also able to see kind of a different subset of patients at the SHFA clinic. So again, the dental chairs are very different. The equipment is very different. But at the end of the day, patient care is patient care. And I'm fortunate enough to kind of see both of those populations. And I'm grateful for that opportunity. So just a kind of an overview of what we'll be going over today. First thing, we'll hit some general dental health trends in terms of flossing, charcoal. Does flossing work? Is it necessary? Charcoal toothpaste, that's a big thing these days. That's becoming more and more popular. And these are some of the questions that I get asked day to day in my office. In terms of mouthwash, does it work? Do I need it? Is fluoride helpful? Should I be using it? Should I not? A lot of do-it-yourself dentistry has been becoming a big trend recently, especially in the past year or so, with Smile Direct Club and Candid and a lot of these type of Invisalign type companies that are encouraging people to do more dentistry from home. As well as we'll take a look at some of the bigger technology trends in dentistry and seeing where that's headed and what the future there is as well. Secondly, we'll hit some socioeconomic trends in dentistry, with the big question being, is dentistry affordable for most people today? And kind of dive in a little bit deeper in terms of the economics of dentistry and how to make it affordable, how to make it work, and what's available right now. And then the final thing we'll touch on is the impact of COVID-19 and the coronavirus on dentistry as a whole, in terms of private practices, in terms of different populations, and kind of the impacts that the whole pandemic has had on dentistry. So the first thing we'll hit on is pretty simple. Flossing isn't necessary. So again, this is a question I get asked kind of day in, day out. It's kind of one of those questions where when someone finds out you're a dentist, like, oh, do you floss, right? So it's a very common question. And at the end of the day, it's a pretty simple concept. And the answer is simply yes, it is necessary. So even on the, let me see, even on the picture there with the teeth, basically what's going on is in between the teeth, there you have little bacteria that sticks onto the teeth called plaque. And the only real way to get that off of there is through flossing. So even if you have the best brush on the market and you're doing a million other things, unless there's some mechanical way to get in between the teeth to clean that plaque off, it causes issues. And to even simplify it even more a little bit, so basically on every tooth you have, say, 5 sides, right? So this arrow is pointing towards the inside, kind of the tongue side. This one's pointing towards the outside, and this one's pointing to the top, right? In terms of brushing your teeth, you're able to hit all 3 of those sides pretty well, right? So you can hit the top, you can hit the inside, you can hit the outside, and your brush will do an excellent job at cleaning all of that. If you have a nice electric toothbrush, that's going to be not a problem. You're going to do great. The trouble comes when you're talking about hitting kind of the behind the tooth and in front of the tooth. And that's where some of the issues come in, where that's just an area where toothbrushes can't reach. So kind of, again, behind the tooth, in front of the tooth, those are the 2 areas where the toothbrush isn't going to reach, and flossing is really going to be your only way to get in there. So again, brushing hits 3 sides, 2 of the 5 sides left untouched if all you're doing is brushing, which equates to about 40% of the tooth has been untouched. And a lot of the times that's where most adults these days, and even kids, are developing cavities. As dentists, we see a lot of cavities between the teeth. That's become the huge thing in the past 10, 15 years, where because brushing habits have increased, with the kind of best electric toothbrushes that are on the market, they all do a really good job. So we're seeing decreased amounts of decay kind of on the top of the tooth or on the side of the tooth. It's more so between the teeth, and that's where flossing is going to be your best bet. Again, this is getting into the weeds of things here, but just to show you on an x-ray what that looks like. Basically, the one on the left you're seeing is some x-rays, and you can see the cavities starting in the side of the tooth. And the only way to really clean that is through flossing. And then the right is a little picture of exactly what you see there. That's kind of an advanced case of what's going on there. But essentially what you're seeing is a cavity starting between the teeth and kind of destructing the teeth from the side in. So that's where flossing becomes really helpful and necessary. Charcoal toothpaste is another big one that we've been seeing very, very frequently. We get asked this all the time, especially in kind of the world we live in with Instagram and Facebook and all the social media, where charcoal toothpaste has become a huge trend, right? And a lot of companies have hopped onto it, whether they're promote themselves kind of as the eco-friendly option or just whitening toothpaste. Overall, charcoal toothpaste doesn't really have any studies to back up any of the claims that they make. Charcoal is a very abrasive toothpaste, and it can take away any stain on the front of the tooth. Using it for continued wear is very, very dangerous to your teeth. We see all the time people that come in who have been consistently switched to a charcoal toothpaste. They have an increased level of sensitivity in their teeth because they've kind of worn away the front of their teeth with that charcoal toothpaste. In most charcoal toothpaste, there's no fluoride, which also we recommend. That toothpaste does have fluoride. And I just think there's much better alternatives available instead of charcoal toothpaste. If you want whitening toothpaste, there's excellent whitening toothpaste out there that work well. If you want something that's more eco-friendly, there's excellent options out there as well. I think charcoal necessarily is not a good material for toothpaste overall. Mouthwash is another common question that we see in terms of what mouthwash should I use, right? And mouthwash is a tricky one because there's no one answer fits all. The reason why is because I think the question of what mouthwash should I use kind of comes from why are you using mouthwash to begin with? And there's a lot of different good reasons why someone would need mouthwash. So for example, there's certain patients out there, a lot of patients who've gone through, say, chemotherapy and radiation have consistently dry mouth, or patients that take a lot of diabetes medications and other medications, dry mouth is a big issue for them. And there's certain mouthwashes that are recommended for them. Others need it just to say, hey, my breath doesn't smell very good. I want something to make my breath smell better. And that's a different type of mouthwash for that. Again, some people need mouthwash to prevent cavities. So we recommend something with fluoride in it. Some people just want a 10-minute better taste in their mouth, and then that's all they want from it. So it kind of, that one's a little tricky of an answer in terms of there's no one answer fits all there, but there is a right mouthwash for every reason there. The general recommendation in that is to avoid any mouthwash that has alcohol in it. And the reason why is because alcohol itself dries out the mouth a lot. So I know Listerine is a big one that has alcohol in it, and it gives you kind of that burning sensation when you put it in. They do that on purpose to make you think that it's working extra well, right? So the more your mouth burns, you're like, oh my God, this is working amazingly well. This must be doing something. In fact, all it's really doing is just kind of burning in there for no reason. It doesn't serve you any purpose, doesn't do much. It's not killing any bacteria. It's not really helping you out. They do that on purpose. It's a marketing thing, right? Because you think you're like, oh my God, this is working. It's burning. In fact, it dries out your mouth in most cases, and it kind of leaves you, it doesn't help you out very much. So I would, Listerine isn't on the top of the list, but again, there's a mouthwash for every reason. So I would either consult with a dentist or just kind of do your research on that one and see what specific reason you want the mouthwash and see which one fits you best there. Fluoride is another one. We in California get this question a lot where a lot of people say, hey, fluoride is poison. I can't get fluoride. Fluoride is bad for you. Fluoride's linked to cancer and all these things, right? And there are certain studies that have those indications that come up from it, but the majority of them come from an excessive amount of fluoride. So the toothpaste, the amount of fluoride you're getting in a toothpaste is not going to cause you any issues. There's been 0 studies to indicate that it'll cause any issues. Just because the amount is so small and it's so localized to your teeth, where there's been 0 studies anywhere that it has caused any issues in any population. In fact, fluoride is one of our few things that actually work well to fight cavities. This is a line that we actually say to kids very often, but we say tooth vitamins, right? And I think it's actually a pretty adept line in terms of describing what fluoride does to your teeth. Fluoride, in essence, just strengthens your teeth, strengthens your enamel. It reduces sensitivity. So for a lot of people, using fluoride on a day-to-day basis is excellent. In my practice and most practices, we recommend any toothpaste is great. You can use Crest, Colgate, whatever you want, right? As long as it has fluoride in it, 99% of the toothpaste are all the same. So as long as just make sure your toothpaste has fluoride in it, and generally that does the trick pretty well for you. DIY dentistry, do-it-yourself dentistry. My big caution would be to be very, very careful. These companies that are promoting this, especially on Facebook and Instagram, and I know I see the ads all the time. I'm sure you guys do as well. And I'm sure a lot of our patients see these ads because I get asked about them weekly. What are your thoughts on Smile Direct Club? What are your thoughts on Candid? What are your thoughts on the 10 other ones that are out there? And my thoughts are always very similar. Be very, very careful. The companies that are leading these approaches to do-it-yourself dentistry, they're not dental companies. These are kind of more in the business world that have seen, hey, if we promote this product to people and we can get them to buy in, we can make money off of it. These are not dentist-centered companies or healthcare-centered companies that are doing this. They'll bring on a dentist later on at some point and be like, hey, be our consultant in this program. But these are very, very kind of business-oriented ventures. So my caution would be I would urge you to be very, very cautious with these. And the results that I've seen from them are also, they left a lot to be desired. The current recommendation for, say, let's look at Smile Direct Club. In fact, Smile Direct Club makes you Invisalign type retainers that you wear on your teeth to straighten your teeth, right? The issue with that is that at no point in that process has a dentist actually seen your teeth. So it's like you take your own pictures, you take your own molds, you do that, and then you send it in. You're like, hey, I know what to do. Just make me the trays and send it back, right? Which is tricky because even us with years and years of training in this stuff, we still encounter cases where we're like, wow, this is a tricky case. Wow, this is complicated. Wow, this is above my head, right? So to expect a patient to just be like, oh yeah, make it perfect, thanks, and then some guy just sends you back a tray, it's very, very, very dangerous. And in fact, there's a lot of talk in the dental world at this point that most of these companies aren't going to last. They're actually going to be, there's so many lawsuits against these companies right now that I wouldn't be surprised in 4 or 5 years that companies like this, of how easy they've made dentistry to be at home, a lot of these companies probably won't last. So be very careful is my words of caution there. Another big trend that we've had in dentistry for the past it's been evolving for the past 10, 15 years, is just implementing a lot of new technologies. So in a lot of our offices, where I'm sure a lot of you guys remember from when you had braces or Invisalign or anything like that, maybe 10 years ago, right? A lot of us had kind of the molds in our mouth where you open your mouth big and someone sticks a lot of impression material down there and you're kind of like, oh God, this is a lot. Now we've kind of changed that up to, we do a lot of 3D scanning in the offices. So what you see there on the left is she has a scanner in her hand and she basically goes in the mouth, kind of rotates that wand, kind of paints the picture on the screen there. And that's real time. And within kind of 4 minutes, you're able to get a 3D model of your mouth, of your teeth in the computer kind of within 4 minutes. And that's opened up a lot of things for us, because what we're able to do now and things that would take us weeks, now we're able to do in 2 days, right? So the technology that we've been able to utilize there in dentistry has been huge. And that's allowed for a more comfortable patient experience, because a lot of people hate the impressions. A lot of people feel like they're choking, they're gagging. And those type of improvements that we've made have become really, really kind of patient-centered practices. In addition, we've done a lot more preventative services. So the focus over the past, the trend towards preventative services instead of kind of fixing stuff, preventing stuff, has become huge, because we've realized that, hey, if we can prevent these issues to come up, we don't need to fix them down the road, right? And it makes our life easier when people are healthier. So the trend towards preventative services, even at a younger age, and more conservative dental treatments has become huge. Dental implants is another big one that's been kind of trending up and will continue to trend up. That one's an interesting one, especially because as people's lifespans increase, people tend to lose more teeth. So say if the average lifespan was 50 years old, right? We only need to worry about teeth for, say, 50 years. But now the lifespan of humans in our generation are increasing. We need to think about, hey, how is this person going to chew when they're 85 years old, right? So the same teeth that the person had when they were 6 years old now need to last till they're 85. So how do we make teeth last 70 or 80 years? And for a lot of people, that's not possible. The teeth start to break down over the course of 80 years is a really, really long time for something to last. So we've gotten big into the world of dental implants to make sure that the quality of life and the confidence that people have when they're in their later years isn't decreased by having, say, dentures or having missing teeth. which kind of impacts largely quality of life issues near that time. The last one is teledentistry. This one's kind of been, this is skyrocketed because of COVID. COVID, we had a lot of closures. So the dental, I would say the teledentistry in our world has been kind of going up, and then COVID hit and it just kind of forced it to skyrocket up. So now we do a lot of, say, virtual consultations on Facebook and Zoom and these type of things in our offices that help people kind of figure out what their options are before coming in. With dentistry being so mechanical and being so in your mouth at a certain point in time, it's impossible to be entirely virtual, right? There has to be a human mechanical element to it. So teledentistry has become really good for consultations and those type of things. But at the end of the day, coming into the office is one of those things that just ends up being a requirement in dentistry. So switching trends here, we're going to jump into kind of the socioeconomic world of dentistry. I know this slide kind of has a lot there, but we'll kind of walk through and see what's going on here. So on the y-axis here, what we have is just money. So the cost. So the bottom of the y-axis is a piggy bank, very little money. The top of the y-axis is a bag of cash, excessive money, right? And on the x-axis here, what we have is a healthy tooth on this side, on the left side, all the way to a loss of the tooth there. So this is showing us is that the biggest trend to see here is that as teeth get worse, they end up costing more to fix. So that's essentially the big element there. So even if we put a few numbers on it, say if someone doesn't have dental insurance, right? And these are some of the average-ish fees you're talking about for a single tooth. So say in the beginning, if a person has a healthy tooth and all they're coming in for is a cleaning, sure, it'll cost, let's just put a number out there. Again, these are just random numbers just for the sake of conversation. If that same person has healthy teeth, you're looking at about $100 for a cleaning and you're all set, right? No issues. You don't have any cavities. You don't have any teeth that need to come out. Pretty straightforward stuff. $100 and you're good to go. As you go down the x-axis and you reach the areas where you have, say, enamel decay or dentin decay, and this is the area where you start to need fillings, okay? And say on a single tooth, your filling is $200, say $300 for the sake of conversation, right? And after those $300, your teeth is all good to go. Perfect. You have no issues. You're kind of back in this $100 world now where you get your cleaning every 6 months and you're good to go. Say we don't fix these when they're at this stage, right? And we let these continue to get worse. What do they end up on? They end up on this world here where you have pulp inflammation. And again, this is kind of moderate pain. And now you're talking about needing root canal treatment. And as I know the words root canal kind of bring goosebumps to a lot of people. And then cost-wise, root canals end up being costlier too, right? So now you're looking at the $1,000 range. And then as you increase, now you have an abscess. If you didn't take care of it at this point, now you have an abscess. With an abscess, you're talking about bigger issues. You're talking about incision and drainage, antibiotics, extractions, those type of things. And again, those go up. And then at the end, say you have a tooth loss, right? The tooth comes out, you have to take the tooth out. And you're talking about doing a dental implant at that point and replacing that tooth. Then the cost is astronomical compared to, say, if you had healthy teeth. So the biggest trend there to realize is that, hey, as your teeth get worse, it's kind of like the worse you are, the more you're going to expect to pay, which in society these days is kind of tricky because you're like, hey, the people who have the worst amount of teeth usually have the least amount of money to fix them. And in fact, we're asking them to pay kind of the highest amount to fix their teeth. And that's kind of where the biggest issue in dentistry from a socioeconomic perspective lies, is that the people who are able to come in for every 6-month cleanings, they have the least amount of dental work needed and they end up paying the least. But the people who can't come in for this because they're working, and the people who, oh, I feel like I have a little sensitivity, but I'm not going to go in yet because I work 16 hours a day and I don't have time, don't come in here. And then they don't come in here. And then eventually they come in when they have an abscess. And then the bill at that point is much, much, much higher from where it could have been. And that's why in dentistry, we're kind of trending to the left there and we're trying to fix those issues when they're smaller, because as a whole, it just ends up being a lot more costlier and the economic impact to patients is a lot less when we're able to take care of things more conservatively in the first few steps instead of waiting until a tooth has an abscess or an infection or your face is swollen and those type of things. So just a few quick facts here. 61% of workers with income below 35,000 have no dental insurance. So again, those prices and the fees that we're looking at on the last page, those become an issue, especially for people without dental insurance. And it's 60% of workers below 35,000. So we're already talking about an income bracket that's kind of on the lower tier. And then if they don't have dental insurance, again, it's kind of a double loss there, right? Annually, dental health related illnesses are responsible for 20 million missed work days and 51 million missed school hours. All right, so if we look back on our chart, most of that is coming from this range over on the right side here, right? Because the pain is so bad that you have to call off work. You're just like, hey, it's hurting so bad, my face is swollen, I can't come in. And once you reach that point, that's where you start calling it off work. And that's where these 51 million missed school hours and 20 million missed work days come from. Emergency room have 2.1 million visits a year related to dental pain. Again, those visits aren't coming from the early stages, right? You're not coming in if you have sensitivity, you're not going to the emergency room, right? You're going to the emergency room only if you're like, oh my God, I can't do anything, I can't function, I didn't sleep at night, my tooth is throbbing, what else do I do? It's 2 a.m. at night, no dentist is open, boom, emergency room. And that's why, again, our trends, we're trying to push more towards the preventative to avoid those bigger issues there. 90% of dental emergencies are preventable with adequate care and knowledge. So again, that goes back to the last slide, the same thing. Most of 90% of dentistry is preventable. If we're taking the time to teach people how to properly take care of themselves and their teeth at home and how to come every 6 months, how to take care of issues when they're small, we're able to prevent those dental emergencies. And that's kind of our goal there. And then the biggest issue becomes, why aren't people coming in? So why isn't every American going for their 6-month cleanings? Why aren't we finding cavities when they're small instead of waiting until they're huge abscesses on the side, right? And a few of the big ones are, the first one isn't as big an issue in California as it is in some rural areas, where the actual physical distance to a dentist office is in California, we're on every street corner, right? I mean, you drive 3 blocks and you'll see a dentist office. There's plenty dental offices. So that one's not as huge of an issue. The bigger issue we do run into is knowledge of resources. So especially in, say, an immigrant population where they're not from America. They don't know, hey, which dentist office do I go to? Can I go to any dentist office? Which office accepts my insurance? Those type of questions are ones that we see daily. And that knowledge of the resources is really, really important. And I think SHFA plays a large role in that. Even the dental health clinic that we've established in SHFA, what we do is when we can't treat the patient or the patient has an issue that exceeds what we're able to do there, we have pamphlets for them. We have papers for them to show them, hey, these are the resources that are there for you. And even that sometimes is enough to get them kind of take that first step in and to help them out and kind of show them where they can find those resources. Economic access is another big one. Essentially, that just means, hey, I don't have the financial needs to pay for treatment, right? And we see that day in, day out. So a lot of times the big focus these days is like, hey, healthcare for all. And then dentistry kind of takes a back step to that. And that's hopefully in the future that changes, but that's currently the way it is. With COVID-19 closure, that's another one where, because we've been closed and because the world's kind of in kind of a weird position this past year, a lot of dental offices shut down. A lot of them open back up. Some are still shutting down, opening back up. So that kind of craziness up and down has led to a few access to care issues. I would say one that isn't included that I forgot to put on here, and one that is crucial that we see every single day, is fear. So most people are scared of coming into the dentist, right? They're like, oh, it's a scary place. And again, that's another issue that goes back to that slide where it's, if you're only coming in when you have an abscessed tooth and you're getting an incision drainage surgery that day, you're going to be scared every time you come in. So our push is always preventative, fix them when they're small, because those appointments, cleaning appointments, are generally pretty easygoing, enjoyable appointments, right? You're there for an hour, you talk to your hygienist, you get your teeth clean, you leave, you feel everything feels nice and polished and it feels good. But imagine going to the dentist only when you have a swelling in your face. Then you're going to hate the dentist, right? It's going to be like, oh my God, every time I go in, they're numbing me up and they're doing surgery and they're doing this, and you're going to be like, the dentist sucks. It's a terrible place. So that's where I kind of pushes more towards, hey, we can alleviate some of those big fear items if we're able to see you more often. And that's become a big trend for us, is trying to get people in more frequently and on easier visits to alleviate that fear. The big the big elephant in the room is always Medicaid when it comes to dentistry. Does Medicaid cover stuff? And Medicaid and Medi-Cal have a division of it called Denti-Cal. In 2008, California basically cut off Denti-Cal and just said, stop right there. We're not doing any more dental services. 2014, they restored some services. So they said, hey, well, if you're abscessed out, we'll take the teeth out, but we won't do anything else. 2018, they restored more services. And it's at a point now where there are some services offered by Denti-Cal, but as a whole, Denti-Cal is not a very robust program. It's a very, very, very poor program. It's not managed well in most offices. Even my private office, we don't accept it because it's just managed so poorly that for the majority of private offices these days, being able to take Denti-Cal just isn't a realistic approach. The reimbursements of Denti-Cal are so low. The kind of the communication with them and the amount of effort we have to go through with them just isn't worth it. So we, as a private office, and most private offices, just don't accept Denti-Cal patients for the purely the kind of the communication and the economic aspects of it that we're just not able to. So hopefully in the future, as they restore more services and as they're able to kind of get a little bit more organized, we see an increased number of offices accepting Denti-Cal patients, and that would really open the doors up for that patient pool. This is another quick slide that kind of hones in on that point of prevention. Oral health is predicted by oral health in childhood. So prevention improves oral health in childhood and consequently in adulthood. So substantial cost savings can be derived from prevention, right? The burden of oral disease is particularly high for disadvantaged and poor population groups in both developing and developed countries. Therefore, an appropriate and egalitarian access to dental care becomes a desirable objective if children's dental health is to be promoted irrespective of socioeconomic status. Another point to even hone in on that more is that statistically, tooth decay is the most common childhood disease. So tooth decay in children usually leads to tooth decay in adults. And the big reason why is a lot of it, tooth decay in children is very, very, very much preventable. There's no reason children have to have bad teeth. A big kind of misnomer in society these days, like, oh, my kid just has bad teeth, or bad teeth run in my family, or those type of things, right? The majority of the cases is not necessarily bad teeth, they're bad habits that run in the family, right? So say if the family doesn't brush their teeth and drinks a lot of sugary drinks and drinks a Gatorade every 3 hours. If those habits run in the family, then those are the habits causing your issues, not bad teeth. So for us, it's a lot of education, especially in pediatric offices and children's offices, where we say, hey, if we're able to educate the kids these days and instill good habits within them, then when they grow to be older and they have better home care and they have better diets that promote good teeth, then we're able to prevent a lot of those issues and kind of as a whole lead to less tooth decay. And that's kind of our goal there. So talking about the socioeconomic trends and where Shifa Community Dental Clinic lies in that. So we established Shifa about a year and a half or so, a little bit over that ago. And the goal is essentially to provide basic dental services. So we're currently limited to emergency services, extractions, and fillings. We've done a lot of good things. We've started to promote ourselves and set ourselves up for the future. So we're able to take x-rays in the clinic. We're able to do fillings. We're able to do extractions. We're able to do cleanings in the office, in the clinic, right? And I would say as a whole, that's a very, very impressive achievement we've been able to get to. Because for a majority of these type of clinics, the hardest step is always the first step, right? Where if we can get ourselves equipped and getting the equipment down and getting the instruments down and getting an x-ray machine and getting x-ray sensors and those type of things, and now that we're equipped for that, the next goal is, hey, where do we expand to? So our goal is to expand more into the preventative services side. And we are, again, with the dental clinic team, we've been talking about and getting dental hygienists on board, getting dental assistants on board, doing more cleanings and trying to provide those services to the community. So we can have a side that takes care of the patient pool that has skipped that middle area. And now we're talking about taking teeth out, but also if we can do this side on kind of preventative side and prevent those issues, whether it's for this generation or the next generation, and the parents that are coming in, if they can teach their children better habits, as a whole, we're making a huge impact in the world of dentistry in the community. Going back to kind of closing things out here in terms of COVID-19 and where we're at with things. March, April, May, most dental offices were emergency only offices. So we were shut down. We were seeing people with abscesses and infections and pain. So we were limited to that. Since June, most offices have opened back up. And we are, as a whole, we've done extremely well in the dental industry with COVID protocols. So the dentistry as a whole, we've always been huge on disinfection and sterilization because we're working in people's mouths all day, right? So infection, it's not like, oh my God, we have new infection protocols and everything's new. It's stuff that we've been doing for years because our duty is to protect one patient from the other patient's stuff, from an assistant, from a staff member. So when it comes to patients who have certain diseases, where the coronavirus is one of multiple diseases that we deal with on a daily basis, right? When it comes to HIV patients, when it comes to hepatitis patients, when it comes to a bunch of these type of illnesses that can be transferred from one patient to another. So we've always had an extremely high level of sterilization protocol. And that kind of the proof is in the pudding there, where in dental offices as a whole, it's been I think it's under 0.5% of COVID positive cases have come from dental offices. So I'd say that's a pretty good success rate there. Dentistry currently is considered an essential service. Most dental offices are open. We recently opened Shifa's dental community clinic back up last week, and we saw a few patients then. So we're hopefully trending up on that, and we're going to try to do a few more clinic openings there and try to provide some services that are needed. COVID-19 screenings, we're doing this in most offices and clinics where we're trying to prevent the spread of the coronavirus in our clinics and trying to make sure that we not only protect ourselves, protect our staff members, but protect other patients from any issues with that. So as a whole, we've done really well with it. There hasn't been any outbreaks in the area. And with proper PPE, we're able to do pretty safe dentistry day in, day out these days. So as a kind of conclusion slide there on the left there, that's the when we opened the community health clinic. I think that was last year. And then, but as a conclusion, most dental work that was done in offices is preventable with adequate home care. If we're brushing well, if we're flossing well, if we're using the appropriate mouth rinse, right? If we have a diet low in sugars and we're eating a healthy diet, most of the dentistry that is being done is preventable. 90% of it is preventable. Sure, we have issues like trauma, or you fall down, you break a tooth, for example. There's no way to prevent that. But when it comes to just day-to-day cavities, those are all very, very, very preventable things. Dentistry currently does have an access to care problem, whether it be economic, like we talked about, whether it be a knowledge thing, a lack of resources. The access to care problem is a reality, and we see it in multiple subsets. I see it in my own office where I have people come in day to day, every single day, who say, hey, I haven't come in years because I'm so scared of a dentist. I haven't come in years. I had a patient yesterday who came in after 16 years of not coming in, right? And he's like, I'm just too scared. And then the kind of the different access to care problem that Shifa is trying to solve is a lot of economic access or a lack of knowledge of resources. So we've seen patients here in the clinic that are, say, a refugee from a third world country that's coming in and saying, hey, I've never been to the dentist. I didn't have access to a dentist for years and years and years and years. So this is the first time I'm coming in, right? And we've seen patients there where we'll ask them, hey, what hurts? And they're like, everything. And they just haven't been in for so long where everything is decaying, everything is breaking down. And a lot of that stems back from, like we talked about earlier, where a lack of knowledge and lack of preventative services over the years have led to the point that they're at now. So if we can instill those preventative services at an earlier age into a larger demographic, we're able to prevent a lot of those issues down the road. dentistry is essential and crucial to overall healthcare. We could have a whole presentation on that and the world of dentistry as it relates to overall health in terms of diabetes and systemic conditions and hypertension and those things. We won't dive into that today, but there's a huge link there. And Shifa's dental clinic, we're definitely in the early stages of the clinic. We've seen extreme growth even over the course of the past year. COVID kind of put a shutdown on things, which did with everything, but I'm happy to see that we're kind of trending back up with that. And hopefully with the support we've gotten from the community, with the support we've gotten from the Shifa team, and I know Dr. Yasmin's done a lot of things, and one of her big emphasis points has been on the dental health side of things, especially with the expansion of Shifa Clinic. I'm excited to see where it grows to, and just the increase in the number of services we're able to provide to the community. So that is all I have. Thank you guys there. And hopefully I shared a few nuggets in there that are helpful for you guys.
Thank you so much, Dr. Khan, for the very informative presentation and for being here today to help educate our community and also for spreading awareness. So now we're going to be taking questions and comments on the YouTube chat. If you are able to contact anyone with your question. So if you have any questions or comments for Dr. Khan, go ahead and put them in the YouTube chat. To start off, I personally do have a question. I was wondering if you could talk a little bit about oil pulling and if that's actually beneficial for your teeth, because I know a lot of people do that. And if you have any remarks on that.
Yeah, good question. Oil pulling is, there's not a lot of science to support oil pulling. Oil pulling is another one of those where a lot of these things stem from people just don't want to floss, right? So then we come up with alternate methods on how to avoid flossing, and oil pulling is one of those methods. So say a water pick has become huge and hugely popular because people just don't want to floss. A water pick in itself doesn't necessarily improve or increase or is a better way of flossing. It's just because people don't want to floss, they pick a water pick, right? And that's the same thing with oil pulling as well. Oil pulling doesn't have a huge scientific backing to it. And again, oil pulling, for those of you guys that don't know, is using certain chemicals and certain oils in your mouth and rinsing with it. And the idea being that the oils in them pull out bacteria and pull out things in your mouth, and they are able to kind of leave your mouth that way. There's no science behind it. The science behind it is very, very weak. And it's not something I recommend, or I know any dentist here in the area or anyone even nationally that recommends it. It's one of those other commercial products that has gained some notoriety just because of its kind of marketing. But I would say the best possible thing in terms of preventative care services you can do is if you're brushing properly with an electric toothbrush, if you're flossing daily, and you're using some sort of mouth rinse that applies to you. Those three by themselves do an amazing job. If you add in there if you add in as well, having a diet kind of low in basic sugars, because sugars are generally what is causing cavities in most people. If we decrease the number of sugars and we up our preventative home care, generally you're able to prevent most cavities and any gum disease and those type of things. So I would stick to the basics and not get too complicated, and you should be in good shape.
Okay, thank you for that. So someone in the YouTube is asking, I see technology that uses UV light and says that it kills bacteria on a brush. Is this necessary, and would it be smart to get one, or is it just a waste of money that looks cool?
Good question. Yeah, there are UV lights that kill bacteria. A lot of the bigger toothbrush companies market this with their toothbrush. So I know Philips Sonicare does this. Oral-B, I believe, does this too on their latest brush, where they'll include a UV unit that kind of sanitizes your toothbrush. I personally don't use one. I have yet to see a huge study that says that the bacteria that's being eliminated by the tooth, by that UV light, is the same bacteria that's causing tooth decay or causing any issues in that sense. I think with COVID-19, everyone's kind of placed a higher kind of emphasis on kind of getting rid of bacteria, getting rid of anything like that. So I don't see it having any negative aspect of it, of doing that, but I don't think it's something that I would go and spend a lot of money on. It's not something necessary. It doesn't necessarily help you out in too many ways other than kind of looks cool and feels good, but I don't think it necessarily has much research kind of backing that up. Good question.
Okay, thank you for answering that as well. I'm not seeing any more questions in the YouTube. Again, if anyone has questions, just go ahead and put them in the YouTube chat. Yeah, I'm not seeing any more. So that's all the questions that we had for today. If you have any more questions, please go ahead and feel free to email us. And we wanted to thank our guest speaker, Dr. Khan, for taking the time to be here and talk to us today. And so now we'll finish off this webinar by providing you with a health education presentation and some resources for our community presented by Alejandra.
Hello. So here are some dental hygiene services in the Sacramento area and some additional information that you might need to know. So if you have Medi-Cal, you have dental benefits. In Sacramento County, there are approximately 58% of children who have Medi-Cal but do not regularly visit the dentist. So it's beneficial to use what you have in your benefits. And if you don't have Medi-Cal, call Sacramento covered at 916-414-8333 to help determine if you qualify. And if you don't qualify, Sacramento covered will provide other options to get the dental care that you need. And these services are provided by the same assistance services that provide Medi-Cal, CalFresh, and other additional services. Next slide. So here is one dental care facility that helps the underserved children in the Sacramento County. They provide health care examinations, oral hygiene instructions, and their information, you can find all of this at first5sacdental.org. Next slide. Adams Dental Associates, they provide affordable prices and services for seniors, and their additional information is, you can see it at smilerestoration.com, where you can find their phone number and additional information. Next slide. And then lastly, we have Natuma's Crossing Dental Care. They provide dental care at affordable prices with or without insurance. They are also in the Sacramento County, and you can find their information at natumassmiles.com. And so additional educational resources so that you can like read up on or just find additional services. So saccounty.net provides steps if you don't have Medi-Cal in order to apply, and what to do with if you have Medi-Cal or if you don't. They have dental facts, they have steps to maintain dental hygiene. And then DHS.SacCounty provides, they actually have a Sacramento County oral health program. So if you're interested in that. And then First 5 Sac Dental provides additional information to take care of your child's smiles with tips to finding a dentist and other and getting low cost dental insurance. And then lastly, we have Center for Oral Health, which provides additional healthcare educational tips and services. And so right here, we have created infographics that shed information on dental hygiene. So the infographics we are presenting you today are information on oral hygiene, how it relates to your physical health, and the effects of poor hygiene. So you can find more of our infographics and sources on our website, Shifa Clinic. You can access this information by clicking on our dental tab. And so first you go to Shifa Clinic. And so then you click on health services and then click on dental clinic from the drop-down menu. And there you can find all our resources, and that's how you can find them.
Okay, we actually have one more question for Dr. Khan. Someone in the YouTube chat asked, I have a quick question for Dr. Khan. What about those light things that you let sit on your teeth, like the HiSmile LED light that whitens your teeth? Do those actually work?
Yeah, good question. So there's a few different companies that have come out with one. HiSmile being one of them, Glow is the other. The other one is Snow. Those are the big ones that market really, really big on kind of social media these days. As a whole, this is getting in the nitty gritty of it, right? The actual chemical that they use to whiten does work, right? So it's either hydrogen peroxide or carbamide peroxide are the two chemicals that are generally used to whiten. Those two chemicals are the same chemicals that we use in office to whiten and has been used for decades, right? So the actual chemicals used in the whitening process are the right chemicals. The light itself and the light activation has no research behind it. So the actual light, whether you use the light or not use the light, is not going to have a huge effect on anything. The light is more of a gimmick than anything, and it makes it look cool that you're doing a lot, but the light itself doesn't do much. The actual chemical that goes on your teeth is effective. So these big companies, the thing is, using whitening trays at home or using just a tray with some whitening gel in it doesn't make for a cool photo, right? It doesn't look cool. Whereas if you have something in there with LED lights, it looks a lot cooler. So that's why a lot of these companies have marketed that and made a big industry out of it. So in kind of to sum up, the light itself doesn't do much for you at all. The actual chemicals used in the process do whiten your teeth. And in terms of teeth whitening, that's another question that we get every single day, right? So in terms of teeth whitening, the best things you can do are just consistent usage of whitening trays. So if you use them every night, 15, 30 minutes a night for an extended period of time, your teeth will turn brighter. The celebrities and the guys on TV, most of them do not have natural teeth. So most of them have veneers or crowns on them. And the shades that are possible with those type of cosmetic procedures, for the majority of the population, just isn't possible with normal teeth. So you're like, hey, I'm whitening. Why am I not getting to where this celebrity has them? Is generally because those celebrity, that's not their natural teeth. It's veneers or something of that nature. But in terms of whitening, using a whitening toothpaste at home, that's okay. The whitening trays, whether it's Glow, Snow, or even kind of dentist made trays, those are all pretty good things to have in terms of whitening. The only caveat in all of that is to be careful if you start developing sensitivity or have any issues with sensitive teeth. Whitening is contraindicated and will make your teeth more sensitive. So be careful with that. If you start having sensitivity, I would cut it off. But overall, the products work. The light is a gimmick.
Perfect. Thank you so much, Dr. Khan, for taking the time to assist us in this webinar and to spread this information. Thank you to our audience for joining us today and for asking us these questions. Please tune in to our upcoming webinar on December 21st. That will be on the topic of domestic violence. And thank you all and have a wonderful week.